The Speaker's bill is intertwined with a House Republican-sponsored measure. Both are now priorities, and the legislation has the backing of the Moore administration.
And I think she will have Delegate Griffith accompanying her.
A bipartisan push, Democrats and Republicans teaming up to change the Maryland foster care system. Advocates are optimistic this will be the year to end hospital overstays and other unlicensed foster care placements. Overstays are a practice when children in state custody who have been medically cleared to leave have no place to go.
These youth who are spending their days in a noisy, unsettling emergency rooms. Imagine that these kids are there sometimes for 7 months, 8 months, for Christmas, if they happen to be there for Christmas. It is the nurses and doctors that bring them gifts and try to give them some type of love.
Hospitals are unlicensed settings, and so are hotel rooms and homeless shelters. Committee testimony pointed out the suicide death of 16-year-old foster child Kanaya Ward as the ultimate failure of the system. The state placed her in a hotel in downtown Baltimore.
Her mom voluntarily surrendered her to the state because she was afraid she was going to take her own life, and unfortunately the vendor allowed her to be unsupervised and then obviously ended up taking her own life.
Delegate Mike Griffin spent years in foster care himself. His bill puts DHS policy changes into law. It prohibits foster care placement in unlicensed settings. It creates an ombudsman position and requires background checks on adults living in foster homes.
We have people on both sides of the aisle who care deeply and have made this a priority.
The Speaker's bill prohibits hospital overstays. Her legislation creates a rapid response placement team and establishes layers of oversight. According to DHS, there are currently 12 children in a hospital overstay situation. Officials say 5 of them will soon be placed.
And effective January 1st, 2027, it will end the use of hospital emergency rooms for pediatric overstay. It is not the place for them to be. But simply ending this practice is not enough.
The Senate committee provided a clear example of its support. None of the members had a question about the bill. Reporting from Annapolis, David Collins, WBAL-TV 11 News.